IVs, but we couldn't do needles. And we were going to try NG tubes, but we couldn't find the NG tubes, so we're doing vitals.
We're going to teach you the most basic nursing practice.
Okay.
So we have to do these every it depends
hour.
on the facility. Like at my facility that I'm at right now, you do them at 10 and 2 o'clock, and then after that, I think it's same kind of like 6 hours or something like that.
And then, if they just got out of surgery, it's every 15 minutes of blood transfusion. You're going to monitor that. If you're going to stay in the room monitoring vitals every 15 minutes. Obviously, if you're in surgery, they're going to have their vitals on them constantly. So it's just...
It depends on the
Yeah, it
patient.
depends on the situation.
But in general, every time you come onto duty, you'll check their vitals, which is blood pressure, temperature, SpO2, which is the oxygen saturation of your blood, pulse and respiration rate. So hi, my name is Jenna. I'm going to be a nurse today. I'm just going to take your vitals. Normally we have a vitals cart, which makes it a lot easier.
So you just put this on your finger, like this. The red light should go on your fingernail, like this. And then it'll give you your SpO2 and your heart rate, so that's kind of cool.
And then for temperature, you put the probe on it first, and then you'll hear it click. And then there's different settings on here, so you can do it orally for adult or pediatric, oral. I don't think this is rectal.
I don't think
But you
so.
can take rectal for children.
I think it's arm
or
and
for
oral.
patients, yeah. For patients that you can't get in with your mouth. So you have them sticking under their tongue.
Can I talk?
No. You can't talk. So it's 98.4. The normal range is 98.6 to 90, or 96.8 to 98.6.
We'll have to go back there.
Trash can. And to get the probe off, you just click this button. Okay, so her SpO2 is 98%, which is good. Normal is 95% to 100%. And her pulse was 79. And normal pulse is 60 to 100.
Use that with nail polish.
No.
No, yeah, you're not supposed to.
No nail
It's good.
polish.
Yeah, that'll disrupt it a little bit. So.
And you can also get it like on their toe or their earlobe
Hmm.
if you can't get their finger. So, or a different finger sometimes. Like
Yeah.
if it doesn't seem right on one finger, you can put it on the other finger. Or you can put it. I think you can put it on their thumb or something. I don't. I know you can put it on.
I know
their
earlobe's
fingers.
the biggest thing. Is like
Yeah.
if something's wrong with their fingers, then you can do it on earlobe.
Okay, so blood pressure is a little bit hard to explain, but basically, wish we had a machine. Really easier, but what you do is you're measuring the systolic and the diastolic blood pressure. So the normal is 120 over 80. So systolic. So you pump it up first. You get the obliteration point. So you put the blood pressure cuff on. Okay, so you put, there's arrows that point to where your artery is, which is right here. So you just put the arrows there. And to get the obliteration point, what you do is you look at this, you close the valve, and you feel the pulse. And once you can feel the pulse, you'll pump this up until you can't feel the pulse anymore. Okay, so I can't feel it at 140. So what you do is you go up 20. So, okay, so what you do is, get your stethoscope on, and so what I'm going to be doing, I'm just going to do it, but I'll explain it first. So I'll pump this up to 160 because my obliteration point was 140. And what I'll do is I'll take my stethoscope, and best practice now is to listen through the bell. So
side is that?
It's the smaller side. And you can adjust, like, when you have it on, if you, like, tap it really lightly, you can hear which side, like, you'll know which side is on. But you put it over the artery, like that, and you listen. And so you'll hear the first heart sound, and it's usually pretty loud if you're on the right spot. So that's gonna be your systolic, which is the top number. And then you'll hear the heartbeat and beat and beat, and then when it stops at that number, that's your diastolic.
So the
that's
very last number you hear.
So that's where you, like, if you hear your first beat at 120 and it stops at 80, that's the blood pressure is 120 over 80.
Do you guys have any questions on that?
So it sounds, yeah.
Sorry.
Do you have a question?
So it sounds like the heart beat. I mean, what do you hear
It's like
in there?
tick, 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 tick. Like typically you'll know.
Sounds like a typical heart.
Yeah.
Blood
It
flow.
sounds like a heartbeat.
Yeah.
Okay.
Like
Yeah,
if you
so
listen
it's
to
very,
it.
if you're in the right spot, it's very distinct, so.
Okay.
I got 120 over 84. And then you ask, sometimes if it's a little high, you can ask, like, is that your normal? Or if it's like really low, if that's their normal, because usually patients that have funky blood pressures, they'll know that it's their normal or not.
And 120 over 90 is considered the normal, or
120 over 80.
oh yeah, 120 over 80 is considered normal. And typically when you do that, you want to have them relax their arm as well. So like on a table or something, because you don't want them holding it, because that can raise the pressure.
And like I said before, it's best practice. Like they teach us now that it's best practice to use the bell, but it's your preference if you want to use the other side or not. Because
What would happen if I had hypertension? What would you do? AdPi.
oh, okay. So we're supposed to incorporate AdPi, which is actually already on the board. It's like a huge thing in nursing that they teach you. So A is assessment, D is
Diagnosis.
diagnosis, and then I forget what
P
they
is
are.
plan, I is implement, and E is evaluate.
Yes.
So,
You would assess, so I just did the blood pressure. Diagnosis would be hypertension. Your plan, so like a short-term or long-term goal, which could be like what they said, you could go on a low-sodium diet, or you could get a prescription for something.
like a beta blocker,
Yeah, beta
or
blocker.
exercise, or
And then you implement, so you do the plan and teach them, you know, like why it's important, what it could do to help them in the long run. And then you evaluate, so you talk to your patient, take more vitals, see if it's working, follow-ups, stuff like that. And then for pulse, you can feel it right here.
it's best to use 2 fingers and going like this versus using your thumb, because sometimes you feel your own pulse. So if you guys want to do this, find a partner real fast.
Or you can do it on yourself. If
It's
you
probably
just-
easier to find a partner though, just
Yeah.
because doing it on yourself sometimes.
And
But
you'll feel
whatever,
it
yeah.
like right here
like
on
right
your
here.
thumb side.
So take 2 fingers. You should be able to feel your pulse.
And you can also feel it up here on your neck.
And you can also feel it in your feet, but
There's a lot of
obviously-
different
yeah, there's
pulses.
different pulses you can
So
do.
like you can, if you can't feel it somewhere, you can always go somewhere else. Or
Do you guys want to try giving each other blood pressures?
They
We
should
have
do
a
it.
couple, so
and we didn't mention respiratory rate. That's another vital sign. You just count their respiratory rate. Like you count how many times they breathe in 15 or 30 seconds. And then you multiply it by, if it's 15 seconds, you multiply it by 4. If it's 30 seconds, you multiply by 2. Same with heart rate. You heart pulse, you check it, count for 15 or 30 seconds, and then you multiply it to make it 1 minute. So it'll be per minute.
Alright, so we have just a couple blood pressure cuffs, so you guys will have to, what was that? Oh, okay.
And then we have some double stethoscopes, so like 2 people can listen as 1 person tries it.
And then, yeah, you guys already know how to do it.
And then you guys know how to put stethoscopes on, you
They
can
probably
use them
don't.
in like this.
You don't have to?
Yeah.
They point.
Oh, yeah, in
Do you
high
guys
school.
know how to do blood
I
pressure?
took that in medical class.
Would you like to do it? Yeah.
We have stethoscopes.
See how they are.
Do you guys, anyone else want to try?
I go with mine. Because the first time I did it, I thought you were going to be a fingerprint. And then it showed up. Yeah.
So I want to put it up here, so you don't want it to be right here. If that makes sense.
I didn't know that you could do nail polish on.
Yeah, there you go.
Especially like the whole row.
Yeah, right there is perfect.
I think we need that. We don't have.
There you go. Yeah, and so you want to see this too. Yeah, that might be.
Can you grab a stethoscope for them?
I'm so sorry. I felt like I was in the
The machines sometimes can't. I've had some
And so the tricky part of this is the valve. And so this is great from the problem is the staples.
Where our fingers try to wipe while you're moving slowly, really.
Well, when you stop. So when you get your foot out, yeah, once you